أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم سبح اسم ربك الأعلى سبحان ربي الأعلى وبحمده رب صل على محمد وسلم. Today I will deal with cholinesterase inhibition and reactivation, followed by some experiments in this field. I will also speak about dibutane and fluoride numbers and their importance in clinical toxicology. Finally, I will speak about clinical significance of measurement of cholinesterase activity. Cholinesterases have two active sites in their catalytic gorges, anionic and static active sites. While anionic site stabilizes the ligand principally via electrostatic interaction, static site hydrolyzes cholinester into acetate and respective choline derivative. In my experiment, I will inhibit cholinesterase by a water-soluble organophosphate pesticide, dichlorvos, and reactivate it by pralidoxime, a cholinesterase reactivator. Dichlorvos, or DDVP, is a water-soluble organophosphate pesticide. Organophosphorus compounds are organic substances which contain a phosphoryl or a thiophosphoryl bond. Most of organophosphorus pesticides are organothiophosphate. These compounds have low anticholinesterase activity and need to be activated by oxidative desulfuration to respective organophosphates to efficiently inhibit cholinesterase. Please pay attention that in oxidative desulfuration of organothiophosphate, thiophosphoryl groups are biotransformed to phosphoryl groups by cytochrome P450 enzymes, leading to the formation of an oxon or oxygen analog of the parent insecticide. Please pay attention to an example of oxidative desulfuration. In this example, you see parathion, which is biotransformed to paroxone by cytochrome P450 mediated oxidative desulfuration. For this reason, I selected dichlorvos, which is an organophosphate and doesn't need metabolic bioactivation. Moreover, most of organothiophosphate are water insoluble. Thus, I selected dichlorvos, which is water-soluble and readily dissolved in plasma to inhibit cholinesterase. Pralidoxime, or 2-POM, is a cholinesterase reactivator and used in organophosphate poisoning as an antidote. You see the mechanism of action of pralidoxime in the slide. For better understanding, I only show amino acid serine residue in static site of cholinesterase and respective reactions. In the first step, oxime group of pralidoxime is ionized in physiological pH of blood. In the next step, it displaces organophosphate, in this case dichlorvos, from dichlorvos bound cholinesterase by a nucleophilic reaction in the serine static site of cholinesterase. Finally, pralidoxime is bound to organophosphate and the active form of cholinesterase is released. The next subject which I would like to point out is dibutane and fluoride numbers. These two indicators are used to determine susceptibility of patients to succinylcholine or succinylmetonium and mivacurium and determination of the pseudocholinesterase variants. These two drugs are muscle relaxants used in surgical procedures to aid in endotracheal intubation. They are hydrolyzed by cholinesterase, but why some patients are susceptible to these drugs? Cholinesterase gene locating on chromosome 3 controls the synthesis of cholinesterase and can exist in many allelic forms. 4 of the most common allelic forms of cholinesterase gene are designated as EU, EA, EF, and ES, which can be combined to form one normal and 9 abnormal phenotypes. The normal, most common phenotype is designated as EU or UU. U stands for usual. The gene EA is referred to as the atypical gene. The sera of people homozygous for this gene, namely EA or AA, are only weakly active toward most substrates for cholinesterase and demonstrate increased resistance to inhibition of enzyme activity by dibucane. The EF gene, F stands for fluoride resistance, gives rise to a weakly active enzyme but with increased resistance to fluoride inhibition. The ES gene, S stands for silent, is associated with the absence of enzyme or the presence of a protein with minimal or no catalytic activity. Mutations that give rise to the atypical and fluoride resistance cholinesterase variants involve a change in the structure of the active center. The variant enzymes, allylozymes, are less effective catalysts than the usual form. Homozygous forms AA and FF are found in 0.3% to 0.5% of the white population. Their incidence among blacks is even lower. In this figure, you see the increased susceptibility of cholinesterase phenotypes to succinylcholine and mivacurium in downward direction. The next topic I'm going to talk about is clinical significance of measurement of cholinesterase activity. Measurements of cholinesterase activity in serum are used as a test of liver function, as an indicator of possible insecticide poisoning, and for the detection of patients with atypical forms of the enzyme who are at risk for prolonged responses to certain muscle relaxants used in surgical procedures. Okay, now let's deal with our experiments. The following experiments are real ones which were performed on real plasma sample of a healthy human individual. I carried out 4 separate experiments on plasma sample. In the first experiment, I measured cholinesterase activity of plasma by Ellman's kinetic method. In the second one, I inhibited cholinesterase of plasma by dichlorvos and then measured cholinesterase activity. In the third experiment, I inhibited the cholinesterase of plasma by dichlorvos in the first step, like second experiment, and then in the next step, reactivated the cholinesterase by pralidoxime and then measured cholinesterase activity. In the last experiment, I determined the fluoride number of plasma cholinesterase. وصلى الله على محمد وسلم.